Hello, and welcome to SimTutor training. SimTutor is an intelligent tutoring system, which is an adaptive instructional system that tries to mimic the well-known benefits of one-on-one tutoring, or the apprenticeship type of training that is the conventional model for teaching histopathology diagnosis. This system will present you with pigmented skin lesion cases to examine in order for you to provide a final pathologic diagnosis, as well as generate a final pathologic report. Our tutoring system is intelligent because, first, it records what parts of the digital slides you have examined, as well as any information you input into the tutor while examining a case or writing your report. Second, due to the collection of this data, if you render an inaccurate diagnosis, the tutor has information that enables it to hypothesize what aspects of your case examination may have led you to the incorrect diagnosis. For example, you misinterpreted a particular pathologic change, or you missed seeing a diagnostic criterion that was present on the slide. If you report an incorrect diagnosis, the tutor will use the information you have provided during your case examination to provide feedback and clues to lead you to the correct diagnosis for the case. In this way, it focuses on addressing any diagnostic pitfalls that you may personally be prone to in making diagnoses on difficult pigmented skin lesions suspicious for melanoma. The ultimate design goal of this system is to simulate sitting at a double-headed microscope across from an expert dermatopathologist and working through cases, with the aim to identify any diagnostic pitfalls you may be prone to, bring them to your attention, and then present you with similar lesions to give you the opportunity to demonstrate to yourself that you have improved your personal skill set in diagnosing difficult melanocytic lesions. While working with the system, you may be asked to locate or confirm the presence or absence of diagnostic criteria and provide differential diagnoses, which should logically lead one to the correct diagnosis. Oftentimes, the most efficient way to complete the case is to ask for hints and go ahead and do what each sequential hint suggests. This strategy will lead you to the correct diagnosis the quickest, so you can move on to the next case while still revealing diagnostic information to you regarding why you may have chosen the incorrect diagnosis initially. As long as you are making correct diagnoses, you will most likely be examining, diagnosing, and reporting these cases similar to how you would in your normal practice. However, if you make an inaccurate diagnosis or a critical diagnostic error, the system starts what might be considered tutoring or teaching activities. At this point, your examination of the case will cease to mimic your normal workflow. This is similar to how current CME activities may provide subsequent and necessary learning activities requiring more time. You work through each case by providing information in 3 tabs in the program. The first tab, shown here, is the Make Diagnosis tab, where you identify important diagnostic criteria and come to a final diagnosis. The next tab is the Type Report tab, where you type up a pathology report including any important prognostic features that should be mentioned. The last tab is the Finish Case tab, where you can order a consult for the case and move on to the next case.